Can OCD be cured? No, but you can manage it through cognitive behavioral therapy, abbreviated as CBT, and exposure response prevention, abbreviated as ERP. In CBT, your thoughts and behaviors are analyzed so that you understand why you're not recovering from OCD and how you can stop your OCD behaviors. In ERP, you're exposed intentionally to the things that cause you stress, but at the same time, you're advised not to perform any behaviors to rid of any uncomfortable feeling that's going to arise. In CBT, there are actually 4 stages when it comes to your OCD thoughts. So the first stage is actually event or triggers. Say, for example, you've just opened and closed a door, and you walked away, become unsure if you've locked the door. So this is where the events and triggers in CBT, you're advised not to put any further thoughts into it, like questioning yourself. What if I've not locked the door? What if I should just go and check one more time? Because if I don't check it and the door is truly unlocked, somebody's going to be able to break in and steal all my precious belongings in my house. This is where the appraiser stage has come in, where you have attached a certain meaning, most likely negative, to what just happened in the events and triggers stage. Say you're caught in this having attached a negative meaning to this events and triggers. In CBT, you're then advised to just accept the negative consequences imagined in your head and let them go, not fighting against it by replacing it with a positive meaning or positive consequences, but literally not do anything, not to have any justifications or reasonings with the thought. And that's the acceptance stage during the appraisal, which you must do during CBT. And if you fail to do so, having attached a negative meaning and found yourself fighting against the thought, reasoning out with the thoughts, you most likely be progressing to the next stage, which is the obsession stage. So in the obsession stage, you're literally like drowning in your pool of thoughts, as a result of you fighting with your thoughts, reasoning out with your thoughts, trying to calm yourself down by these justifications. For example, you're saying to yourself, I've locked the door 2 times just now. I've went and go and check and lock the door. It's all fine now. There's nothing for me to worry. That's a form of like reasoning with your thought. So it's actually encouraging the obsession stage to go on longer. The other forms of examples, like you trying to justify against your thought to spur the obsession stage further, it's like, I've actually pushed the door real hard, and when I lock it, I've actually twisted the key in the keyhole in the right direction to the fullest, and actually pull the key out of the keyhole as well. But then, so these examples, you get the idea. You could have more and more examples of the sort of justifications. The problem is, when you justify like this against your thoughts in the obsession stage, for example, you tell yourself like, I've really twist the key in the keyhole to the fullest direction, in the direction that locks the door fully securely, for example, in order to assure yourself that is. The problem with that is, then you start to, your mind might come back with another comeback, like it would say to you, are you sure that when you do that, you've not left the key in the keyhole? So I guess you can see where this is going. Like, the more you try and reason out with your thoughts, the more scenarios, justifications is going to present back to you as like a sort of a retaliation. So in CBT, you're just, as I said, like you're supposed to just accept the negative consequences and stop fighting against your thoughts. But say if you fail even at this stage, you just keep arguing with your thoughts to no end, but sooner or later you find that The more that you argue with your thoughts, the more your anxiety and panic attack spikes. To a certain point that you can't bear it anymore, then you have to do certain actions to rid of the feelings, the uncomfortable feelings. And that's what we call as performing compulsions. That is, doing certain actions to rid of the uncomfortable feelings that you're really feeling at this point. In CBT, you're advised not to do any, and if you're doing any, then you're supposed to just stop doing them. So how does ERP work for OCD? The way that ERP works is that you're first exposed to the thing that causes you the least stress, but not perform any compulsions. When you manage to do that, then you move on to the next thing that causes you slightly more stress, but still not performing any compulsions. Gradually, you move on to tackling the thing that causes you the most stress, but also not performing compulsions. And that's the goal of the ERP here, is to also train your mind to actually perceive that the dangers that you have in your mind, that you perceive in your mind, doesn't actually happen, or that doing the OCD behaviors and checkings and whatever doesn't really change the consequences that you imagine in your mind. Is to actually train your mind to eventually, both CBT and ERP in the long-term goal, is to actually train your mind to just be able to accept whatever that's happening, that's starting at the thought process down to the checkings of OCD behaviors, to just accept them and move on, and at the same time letting the anxiety and panic attack uncomfortable feelings go down really quickly. But of course, at the start, when you do this, your anxiety and whatever uncomfortable feelings is going to be so high, but the more you practice, the peak level where these uncomfortable feelings would go to would gradually go down lower and lower and faster. The moment you not do any of the OCD behaviors you've been doing all along to make yourself feel safe. How long does it take to recover from OCD? Some might take days, weeks, months, and some even years. It all really depends on an individual's progress. As for my case, speaking from personal experience, I've taken a long time, probably around half a year now, from practicing CBT and ERP every day. So this brings me to the next question of how can I recover from OCD? By practicing CBT and ERP every day. It's best that you get a therapist to assist and guide you in doing these two techniques. But if you can't, you have to do it alone, like I had for a long time prior to me being able to get a therapist. Then you could go to my website, www.cluelesspots.com, and there you will be able to see a link on the top menu that's called resources, and there I've actually linked to a bunch of ebooks that I've actually used intensively before I was able to afford to see a therapist. But if you're able to see a therapist, then by all means get one, even though they're going to cost quite expensive. And bear in mind as well, treatments with therapists is going to take a while. As I understand it, it's something that's meant to be long-term, and so that you stay on track and not fall back in terms of progress. But if you're not able to, as I've said, then you have to rely heavily on online resources, including the ebooks that I've just mentioned. Those are used intensively every day. But the key goal is to actually, with every tip that you learn, you pause from learning more, and you just don't move on to the next thing to learn until you manage to practice in real life, application-wise, the thing that you've just learned. This is so in order that you don't get so confused in your mind when you're caught in the middle of the ritual. Because when you're caught in the ritual, it's impossible to actually remember all the things and also to practice at the same time to get out of the OCD rituals or whatever that you're having at the point in time. So the last thing that I want to leave you with, if you ever caught in an OCD ritual or whatever, from my personal experience, if you ever find it too confusing, like, whoa, there's like too many things that I've got to remember, which one do I practice? So you just remember, well, this really helped me. So what I do is I just tell myself, stop doing what I'm doing now and just move on to doing the thing I originally planned to do, which is writing a blog, watching a movie, or spending time with my children, for example. And you could pick that from one of your favorite activity or work activity that you have and moving on to doing that thing. I hope this helps you. Please feel free to ask me any questions. I'll try my best to answer them in the comment section. If you see this on my website, www.cluelesspaths.com, which I'll link in the description, or on the comment section in YouTube, wherever you see these. Take care and all the best in your managing of your OCD every day using CBT and ERP.